My name is Wendy Waters-Connell, and I am the CEO of the YWCA Hamilton, located in the southwest corner of the state of Ohio between Cincinnati and Dayton. What I want people to know about my heritage is that I am a descendant of Native Americans. It's a proud heritage that I carry with me, but it's not the only heritage. I also carry European heritage. I believe that racism affects the indigenous communities, especially around healthcare disparities, primarily has to do with access. For indigenous communities, they live in very remote areas and have very little access to sophisticated life-saving medical care. For instance, an elder who's in a state of respiratory distress on an Indian reservation out in the West might have an hour's helicopter ride to the nearest intensive care unit. That literally could be a life or death situation. Additionally, I believe that there are elements of depression and isolation, of course, addiction, that impact communities of color and certainly indigenous communities that also have complex layers of survival ratios relative to COVID. Specifically, the Navajo Nation has lost almost 7% of their elder community. Elders hold the culture. They're the language speakers. They know the dances and the songs and the narrative of the community. And if you lose enough elders in a short period of time, you're at risk of losing whole components of a culture and a sense of identity. That will have lasting impact on generations that aren't even born yet. When addressing public health concerns, especially with a racial justice lens, the most important component to me is being aware of how different the outcomes are for Black, Indigenous, and people of color. I don't think there is enough emphasis and data that is shared to help the wider communities appreciate the long-term impacts on these communities. So paying attention to the death rates on reservations and with elders is one way to understand how this will impact Indigenous communities into the future. The epidemic of missing and murdered Indigenous women is also a public health crisis. So we're talking about violence against Indigenous women that are not appreciated because they're at the highest rate of any minority community within the United States. There are changes in policy and changes in laws and changes in databases that are helping, but this is a widespread epidemic across Indian country. What I would like to see to address these issues of health disparities is attention to database management, data collection, transparency of data. It's only when we know the facts that we can develop policies to address those disparities. When there is secrecy and a lack of awareness around what's happening on reservations, no resources can be funneled to those areas of concern. Missing and murdered Indigenous women in the United States is the direct example of intersectionality and its negative and toxic effects. Women and girls go missing off of reservations every day, and there is less attention given to that epidemic than any other.